In this video, we will discuss about subdural hematoma, its causes, clinical features, imaging, management, prognosis and complications. What is subdural hemorrhage? Subdural hemorrhage is bleeding between the dura mater and the arachnoid membrane. It is caused by tearing of the bridging veins. What are causes of subdural hemorrhage? Trauma is the common cause. It causes direct head injury, thus causing tearing of bridging veins. People at risk of subdural hemorrhage. It is more common in elderly due to brain atrophy, which increases tension on veins. There are three types of subdural hemorrhage, depending on their duration. Number 1. Acute subdural hemorrhage. Its onset is within 72 hours of trauma. It has severe symptoms with rapid neurological deterioration. Number 2. Subacute subdural hemorrhage. It develops between 3 to 21 days after injury. Its symptoms progress gradually. Number 3. Chronic subdural hemorrhage. It develops over weeks to months. It is common in elderly, and may mimic dementia or other neurological conditions. What is the pathophysiology of subdural hemorrhage? It has following mechanism. Step 1. Tear in bridging veins. Venous bleeding is slower than arterial bleeding, leading to a gradually enlarging hematoma. Step 2. Mass effect on brain. Accumulating blood compresses adjacent brain tissue. Increased intracranial pressure can cause herniation if untreated. Step 3. Inflammation and rebleeding. Chronic subdural hemorrhage may involve rebleeding due to fragile neovascularization. Clinical features of subdural hemorrhage. They are different for acute and chronic types. Symptoms of acute SDH. It includes headache, confusion, drowsiness, focal neurological deficits, rapid decline in consciousness or coma. Symptoms of chronic subdural hemorrhage. It involves insidious onset of headache, memory loss, personality changes, subtle cognitive impairment, seizures or motor weakness. What imaging is done in subdural hemorrhage? CT scan is the gold standard. It is crescent-shaped, concave hyperdense lesion that crosses suture lines. MRI. It is useful for subacute or chronic subdural hemorrhage. It detects older blood products and underlying brain pathology. Management of subdural hemorrhage. In case of acute subdural hemorrhage, it needs emergency surgery, like craniotomy to evacuate the hematoma, or burr hole drainage for rapid decompression. Intracranial pressure management with hypotonic saline or mannitol. In case of chronic subdural hemorrhage, it needs minimally invasive procedures, corticosteroids or observation for small, asymptomatic hematomas. In case of supportive care, monitoring in acute is done for neurological and intracranial pressure changes. Physical therapy and rehabilitation needed post-surgery. Complications. It can cause following complications: neurological deficits, persistent motor or cognitive impairment, brain herniation, life-threatening due to pressure on brainstem structures, seizures. Increased risk in chronic subdural hemorrhage due to cortical irritation,